Corinna, she's the Director of Center for Food Policy at City University in London, and she is co-chairing the independent expert group behind the Global Nutrition Report, and we're honored to have you here, Corinna. Welcome up.
Thanks. Thanks very much. Thank you, and thanks for that generous introduction. It's fantastic to be here in this wonderful castle. So thanks very much to my host for inviting me to give this talk this afternoon. So I'm going to talk about obesity coming from the perspective of undernutrition. I'm going to talk about the double burden of malnutrition, what I like to call malnutrition in all its forms, and how obesity is part of that. So, thinking about it, we're all working as part of the Sustainable Development Goals. And the international nutrition community is particularly focused on Sustainable Development Goal 2, which says clearly that the goal is to end hunger and to end malnutrition in all its forms. And by that, it doesn't just mean undernutrition by malnutrition, but it means nutrition, malnutrition such as obesity and diet-related non-communicable diseases. And it refers specifically to the 2025 targets for global nutrition. And if you're not familiar with those targets, here they are, adopted by the member states of the World Health Assembly of the World Health Organization in 2013. And you can see that they are largely under-nutrition focused. And this is the set of targets that is the rallying cry for the international and developing world nutrition community. But there's another community too. A community I think is probably more represented here today, the global health community, which has adopted the critically important cause of non-communicable diseases increasingly over the past few years, and that is dealt with in a different goal of the Sustainable Development Goals, which begins to reflect that the global nutrition community and the global NCD and health community have actually operated side by side rather than being very integrated. However, we know that nutrition is intrinsically related to NCDs, and yet they are separated. Now, that makes sense to a certain extent. This is a different set of targets, also adopted in 2013 in the WHO, which includes obesity as a particular target, but adult obesity. So you have adult obesity in one set of targets and under 5 obesity in another. But of course they are connected in reality. This is an infographic put together by the NCD Alliance, and the infographic shows when it comes back up, that of course nutrition is part of NCDs, that agriculture and food policy that part of NCDs. The NCDs are much broader and spread throughout the Sustainable Development Goals than just being part of that Health Goal 3. And some analysis that we did at the Global Nutrition Report also shows clearly that when you look at the indicators of the Sustainable Development Goals, that there are just as many indicators in the health goal that affect nutrition than there are in the health goal, in the nutrition goal itself. In fact, there are more. So the point I'm trying to make here is that in global health, nutrition is a really important part of it, and vice versa, and yet we've operated in separate communities. And one of the things that we try and do in the Global Nutrition Report, and there are executive summaries out there for you to pick up out there, is to try and bring these different aspects of nutrition together. And so what we do in the Global Nutrition Report every year is to track progress against not just the undernutrition focused targets, but also the obesity and NCD related targets as they are relevant to nutrition. And the power of doing that comes about when you actually start to look at the data. By looking at undernutrition together with obesity, and in this case diabetes, you begin to see the bigger picture. You begin to see that the world is making some progress, that's the green, on addressing forms of undernutrition. That's wasting, being too thin, stunting, not growing properly. But when you bring obesity into the picture, you see that we're not making any progress at all. So progress is too slow on undernutrition and non-existent when it comes, practically non-existent when it comes to adult obesity and diabetes. And when you bring all of these together, then you have the full scale of the problem of malnutrition in all its forms. You have malnutrition affecting all 193 countries, affecting 1 in 3 people. This is a vast problem for global health. So you have these are some stunted kids in Tanzania. This is our image of malnutrition in the developing world. But we have malnutrition among us too. This is malnutrition, as we call it, overweight and obesity in the Nordic countries. While overweight and obesity among adults is lower than many other countries here in this region, it is still high and it is still increasing, particularly on the overweight side, not so much on obesity. So by giving this bigger picture, we begin to see that malnutrition affects all countries and many people. But it's not just about the poor stunted kids in Tanzania and the overweight ones here in the West. We have a double burden of malnutrition. We have undernutrition coexisting with forms of malnutrition associated with excess consumption. This is the combination in high-income countries of anemia with overweight. This is the high-income countries have a double burden. Not every country, but many countries have a double burden. And this is a very complex slide, but it basically shows that there are multiple overlapping burdens of different forms of malnutrition around the world. And this is what we're calling the new normal, where almost coming up to 50% of countries have some form of double burden. And we know that food and diet are critical drivers of this double burden. We know, and you will know and have seen this, that many factors related to diet are in the top 10 causes of the global burden of disease. In the global health community, we were immediately thinking about heart disease, diabetes, obesity, etc. But poor diets is a matter not just for the junk foods, if you like, consumed by people at risk of obesity and diet-related NCDs, but very, very poor families at risk of undernutrition as well. The data on dietary quality around the world is absolutely abysmal. It is shocking when you look at it, and the data is not brilliant, but the data that we do have shows that at a median level, only 15% of children under the age of 2 are consuming what is considered a minimally acceptable diet. That is absolutely abysmal. And this data, about 50% of women in sub-Saharan Africa, 50% did not consume any form of nutritious foods the day before. So of course this is going to lead to micronutrient deficiencies. And of course, I don't need to give you the data on rising consumption of sugars, fats, and this ultra-processed food, which we see everywhere. And we see this rise of junk food everywhere, not just in the West. This is some recent data from Egypt, from Upper and Lower Egypt, where kids are at risk of undernutrition, to show that 30% of the diet of those kids is made up by what this academic paper defines as junk food. This is data from Nepal. Nepal is not a wealthy country. And this is data showing that 60% of kids consume cookies, sweetened, fatty cookies, on a daily basis. This is children under the age of 2. So we have children under the age of 2 consisting on lots of starch, no nutritious food, plus cookies. This is not a good situation. And of course, what's happened is that those kids were at risk of undernutrition. Now they're consuming the unhealthy foods, and then they're at risk of obesity. We have to see this as one problem. What approaches have been taken to date to address this problem? Again, in silos. These are some reports that have come out about approaches to addressing obesity. The ECHO report from the WHO is, of course, the most recent international example. And I did with colleagues, did a review of all of these reports as well as what countries were doing at a national level several years ago. And it was clear that what countries were doing to address obesity were consolidating around 10 different areas. And I put together in my previous organization, World Cancer Research Fund International, who are represented here today, something called the Nourishing Framework, which lists clearly the 10 main areas and the ways in which countries are tackling obesity. And this is absolutely consistent and was intended to be consistent with WHO recommendations in this area as well. Focus on that. This is not talking about physical activity, but just focus on that. That's all about improving diets. That's what it's about. Let's go to the undernutrition world. Very different world. In 2013, a very, very influential, actually 2008, followed by another edition in 2013, very influential journal came out, a series of articles in the Lancet came out and specified where there was really strong evidence for reducing malnutrition, undernutrition among children. And it was based on this concept of the first 1,000 days, this idea that you need to intervene in the first 1,000 days from conception onwards in order to tackle undernutrition. Very powerful evidence on that. But the interventions for which randomized control trials showed were effective were essentially about nutrients. They were essentially about fortification, supplementation, different forms of treatment. Now, this has been put together by some extremely strong evidence, and it's accurate and it's correct that these interventions are powerful interventions, and of course they include breastfeeding, which is absolutely critical. However, there's other forms of evidence on undernutrition that shows that actually in practice, the countries who have achieved declines in stunting and wasting and other forms of undernutrition have done so because poverty and basic public services have been addressed. So purchasing power and poverty is critically important in addressing undernutrition. And I went through all of the global nutrition reports which have been produced through 2014, so that's just 3 years now, and actually looked at the success stories on undernutrition and found that none of them actually mentioned food or diet. Because the focus of undernutrition has been either on poverty or on nutrients. But before that, in the 60s and 70s, the focus was on food availability. The idea was, in the agricultural community, that just produce enough food, feed the world, you're sorted. You've got enough calories, get enough ag, you're fine. This is just not the case. I mean, the issues of distribution, issues of food quality, nevertheless, the narrative in the agricultural community was, produce more, we'll be fine. This made the international and national nutrition communities absolutely livid. And as a result, they moved away from food. It wasn't until about 2 years ago that I could go into a room and say, I think food's important. But they'd be saying, no, 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 because water sanitation is important, breastfeeding is important, etc. I'm like, I know, but maybe we need to start talking about diets. That didn't go down very well because there was this leftover hangover of this concern that if we talked about food, we were going to go back to these times when it was just assumed that enough food was enough to address undernutrition, which we know it isn't. So this led to what I call the diet disconnect in the undernutrition community. You had people in the community dealing, and this, when I say community, I'm talking about policies. I'm talking about what happened in practice. That's what I'm talking about. There was direct nutrient interventions. There was this efforts to reduce poverty, and the agricultural community talking about food production. So very crudely, this is what was happening in practice to address undernutrition. And as a result, diets, the quality of people's diets got forgotten about. And this is what I call the diet disconnect. But there are actually 3 levels of the disconnect. The first disconnect is that the diets in between the nutrients and the purchasing power got forgotten in terms of policy interventions. The second is the fact that food environments around us influence what we eat wasn't considered, because all it was considered was, as long as they've got enough food, that's fine. And so they're not making any choices in their food environment, so we don't have to worry about that. And then finally, the food system got forgotten because it was just talking about production rather about food system from farm to fork. And you can see when undernutrition policies were implemented that were around diet, you can see here that they were flawed. Because, for example, on school feeding policies, they focused on making sure those policies provided enough food, but they didn't look at the quality of food. So in other words, here in the West, we're focused on school food standards and getting school food healthy. They're just focused on making sure there's enough food rather than the quality of that food, as this academic paper shows. So still today, you get this idea. This is a recent photo from the Middle East, a refugee situation in the Middle East, where healthy school meals are seen as long as it's enough, it's fine. So if it's a muffin, it's fine, it's healthy, it's enough. Still today, we have a lot of work to do. And by the way, I should say that I work very closely with my colleagues in the undernutrition community, and some of you may be here today, and they are wonderful, wonderful, committed people. What I have done is a piece of analysis over a past trajectory that often happens without people really realizing it. It's just the situation here today, and we need food policy to address it. So first, what can food policy do? Well, first of all, we need to unify the food-related causes of malnutrition. They're not all about food. We know that: physical activity, water, sanitation, breastfeeding, etc. But the food-related causes around diet quality, and focus on improving the quality of diets for everyone. That's critically important. This is a report that came out very recently from the Global Panel on Agriculture, Food Systems and Nutrition, which I contributed to, which goes over some of these issues. The second thing is we need to shift policy maker mindsets around the world. That we have a bigger problem of malnutrition, and if you're in an aid agency in Sweden or Norway, it applies to your development aid. If you're in a high-income country with a double burden, it applies, and it applies to all of those countries with multiple burdens. But the idea is that we need to make our food policies do double duty. That means that if you are implementing a program to address undernutrition, you are thinking about whether it might be increasing risks for obesity, such as a school meal program, which is actually providing unhealthy food, even though the intentions are good. So we need to be thinking about investing our policy resources in policies which are going to reduce the risk of all forms of malnutrition. What we coined in the Global Nutrition Report 2015, double duty actions. Thirdly, as part of that double duty process, we need to introduce policies to encourage healthy diets for healthy growth for everybody. Every child deserves healthy growth. Whatever form of malnutrition they're at risk of, and everybody and all are, every child deserves healthy growth before the age of 2 and onwards. So we need to clearly articulate policies that target young children so they're going to be well nourished and grow well, but also develop healthy preferences so that they enjoy good, healthy diets when they get older. And here are some examples of potential policies that address all of those risks in a double duty style. And finally, we need to identify opportunities to lever food systems across the board. This is a diagram from the report I showed you 3 slides ago. We need to lever food systems entirely towards addressing these different forms of malnutrition, so we can find exciting opportunities way back in the food system that's fundamentally going to change the way we eat, change our food supply, change the way that food is supplied to us, to help us all enjoy good and healthy diets and reduce the risk of malnutrition for all. And now we have a great opportunity to do that. We have a decade of action on nutrition, which was adopted by the United Nations recently. This is a tent for us all to come into. Any of you here that is doing anything, even tangentially, that can address any form of malnutrition can be part of that decade of action. Thank you very much.
Thank you so much, Corinna. Great to listen to you. Boyd, what are your reflections when you hear Corinna talk?
Well, I told you you'd be in for a treat. I want to ask you, Corinna, about we have all these people, governments and donor governments and other foundations and NGOs and scientists dealing with this undernutrition problem, which is creeping down. It's not getting fast enough, down and down, and yet up behind them is all this NCD and obesity that they're not looking at. You're co-chair of the Global Nutrition Report, and you put out a lot of facts and figures and things. What are the killer facts or the concepts that actually get it across to people who've been focusing on one area to turn around and see this beast that's coming up behind them that's going to consume a lot of their finances and the development problems that they're facing?
I would say we're not there yet, in the sense that
still practicing.
The donor community, and particularly the international donor community, is way behind national governments in this. You go to governments all over the world, they'll say we've got an obesity problem, we've got an NCD problem, or we've got a growing one, it's incipient. But the donors and the foundations don't want to give money to that. And that's for good reason. It's because they're concerned that that's not what they're there for. They're not there to deal with people who are making choices. They're there to deal with the fact that people don't have enough. So the narrative is an ethical and a moral one, which I understand. So I think what's going to change the picture is actually when people go into the field and go into hospitals and see people suffering from diabetes and cancer and older people from heart disease. When they go into slum areas in cities and they see very overweight kids sitting around, bored, listless, unable to do anything. That is a reality, but actually people aren't really seeing it, and they're not seeing the human dimension. And I think they've got to see that human dimension for that to change their minds.
They've got to see the human dimension, but they also have to look beyond the fact that this is an individual. Once you've got obesity now, that's a personal responsibility, personal choice thing, whereas undernutrition is clearly seen as more systemic. And so there is that switch as well, isn't there?
I think there is a switch, and that's why the focus on food environments and focus on food systems is really important. So a lot of work I'm doing at the moment is focusing on food environments and food systems as a way of saying food systems are at the moment not working for undernutrition, they're also not working for obesity, to try and find food environments, trying to find unifying concepts.
So can I ask you both a question about leadership? Political leadership on national level or local level seem to be very important. How do you make national political leaders listen? We can take a case in point with just a new obesity strategy in Britain, for instance. Is that political leadership?
I mean, when you look at the political we did an analysis in the last Global Nutrition Report on this, and it's very clear that all the countries who have been successful in reducing undernutrition, very clear that they have had strong political commitment. It's like the factor that cuts across all of it. So basically they've said, I'm going to comprehensively reduce stunting, retarded growth among my kids, and they do it. The World Bank has now got a huge summit on stunting coming up. So your question is, well, what helps them make the decision? I think it varies. Some of them it's personal. They see it. Sometimes it's embarrassment. Ethiopia, for example, maybe some people here from Ethiopia, I'm told, were very embarrassed about the fact they had famine after famine, and they were seen as this famine-ridden country. They wanted to be seen as a jewel of Africa with economic growth. Those countries don't have famine. That was another factor. Some of it is financial. Sometimes the financial argument that this is costing so much money has really gone. So I think there's always something that gets them, but it does vary between different contexts.
Yeah, what do you say?
So, well, I think then the trouble with the obesity side is it's a different space, and it's much more contested, and we don't have any countries that are examples. You can say, okay, go to these 5 countries, they've managed to reduce obesity and just would do what they did, and you'll be fine. We don't even have that. And so I think it's a much tougher space actually for politicians dealing with obesity and NCDs. It's more complex, more contested, and it's tougher, I think. So I think the people who do show leadership are people, and I think Michael Bloomberg was probably a classic case, who kind of get it. They really understand public health, and they understand the the systemic and the environmental causes, and they don't just dump it on choice and leave it up to the market. So that's a kind of an understanding thing as well.
Is there anyone who want to pose a question here? There are microphones in the hall. Quickly raise a hand in that case. While you're thinking,
Yep,
yeah.
over here.
Thank you. That's an excellent explanation. This is Ahmed from Egypt. I want to tackle some actual and practical point. That is the correlation between democracy and obesity. Because obesity is, even in the poorly developed countries and in developing countries, it has become now well seen that it is another face of the coin of malnutrition. In these miserable areas, you can't get real forward step in advance if there is no democracy. Because good nutrition, good health, good school environment, sporting, physical activities, these things are for the welfare of the whole society. The welfare of the whole society is properly targeted when the situation is in a democratic situation.
So the question is, do you need democracy to get rid of obesity?
I would say you do, but you have obesity in a lot of democracies.
You need a few other things.
So I take your point in terms of effective policy responses. And obviously the famous relationship is between, as Amartya Sen said, the famous development economist, talked about you need to have democracy to not have famines. And that's quite a clear relationship. So I think it's an interesting point you make there.
Yeah, the Amartya Sen argument. Yeah,
There's one over here.
here.
Paulina Nowicka, Uppsala University. Well, I missed the morning presentation, I have to acknowledge, but there's one perspective that I find very important, but maybe it hasn't come across in this presentation, is the social inequalities perspective, that those that are mostly in need for interventions, these groups, we are not successful. We don't have good methods to help them yet. So any thoughts about that?
We did touch on inequalities this morning, and I think it's absolutely critical. I think the problem that we're seeing people trying to, or governments trying to address inequalities, is more saying, okay, let's find these people who really do have problems and let's kind of super target them, if you like, those vulnerable groups, rather than seeing that policies which go across the whole population, like sugary drinks tax and restricting marketing and things, are pro-equity in themselves. So they don't kind of see that these population-wide policies are very pro-equity.
We can have one more question,
Yes,
I think. Over there.
Hi, sorry,
Hi.
we're far in the back. Good afternoon, everyone. I'm Tamara Stevenson, founder, CEO of WANDA, Women Advancing Nutrition, Dietetics, and Agriculture in Washington, D.C.
Short question.
And I wanted to just share, my question is on human capital investment. In D.C., we have a big focus on we can build grocery stores that'll solve the food desert issue. But what do you see is the benefit in creating children as advocates for the change that we need in our food system, similar to what we've done with tobacco-free kids? Can that apply to also women and girls becoming champions for nutrition as well?
Yeah, I think also following from Boyd's point, I actually think we've done a really poor job in the kind of obesity prevention community of bringing people in. I have really moved my position in the last decade on this. That I take Boyd's point, for example, about needing structural interventions. I completely agree with that. But I think we haven't done enough to tailor what we are doing to the realities of people's lives. People's lives are very difficult, and there's a reason why they make certain choices, both people who experience undernutrition and obesity. And actually to bring them in a participatory way to the process in a meaningful way, not in a superficial kind of pat on the head kind of way, but in a meaningful way into the policy process, that to me is the big gap. And it's why at the Centre for Food Policy, we're going to be focusing our work very strongly on people in policy and sort of more people-centered approaches in policy. And I really think it's really a critical point.
Thank you so much, Corinna and Boyd.
Am I supposed to stay up here?